The Pap smear test is a type of cervical cancer screening test that women undergo. Its primary purpose is to detect any abnormalities in the cells of the cervix, cervical cells, or signs of cervical cancer. In this test, a healthcare provider takes a small sample of cervical cells and sends it to a laboratory, where the cells are examined under a microscope. This test is usually a part of routine checkups for women and helps in the management of their reproductive health. Cervical cancer, also known as cervical carcinoma, is a serious disease, and the number of women affected by it is increasing rapidly worldwide. According to a report by the World Health Organization (WHO) on human papillomavirus (HPV) and cancer, in India, one woman dies from cervical cancer every 8 minutes. The Pap smear test is the most common method used for detecting cervical cancer. However, does every woman need to undergo this test? How often should the Pap smear test be done in a year? When is it necessary for a woman to get a Pap test? Is it truly effective? Let's find out the answers to all these questions. Cervical cancer is a disease that often goes unnoticed as it develops internally. Detecting it takes time, and by the time it's diagnosed, the cancer might have advanced. This is why the number of women dying from cervical cancer is on the rise. To mitigate this risk, it's essential to get regular Pap smear tests done to identify and treat cervical cancer in its early stages. What is a Pap smear or Pap test? A Pap smear test is a screening test for the early signs of cervical cancer. The cervix, which is part of the female reproductive system, is where the vagina meets the uterus. A Pap smear test can also help detect HPV infections. By getting timely Pap tests, cervical cancer and related conditions can be identified early, enabling effective medical intervention. How is a Pap smear test done? For a Pap smear test, a doctor or technician inserts a tool called a speculum into the vagina to visualize the cervix. Using the speculum, they collect a small sample of cells from the cervix. These cells are then examined under a microscope to detect any abnormalities. If abnormal cells are found, further diagnostic steps can be taken by the doctor. Does a Pap smear test hurt? During the procedure, you might feel a slight discomfort as cells are collected from the cervix. However, the test itself is not painful. You can get a Pap smear test done at a nearby clinic or healthcare facility. What precautions should be taken before a Pap smear test? Before a Pap smear test, it's recommended to avoid using vaginal creams, sprays, douching, or spermicidal foams for a couple of days. These can interfere with the accuracy of the test. How effective is the Pap smear test in detecting cancer? The Pap smear test is effective in identifying abnormal cells or cells that might become cancerous in the future. It provides doctors with an easier way to monitor for changes in cervical cells and take appropriate action if abnormal cells are found. When should women get Pap smear tests? In general, every woman should start getting Pap smear tests after the age of 21. Many women believe that only sexually active women should get tested, but this is not true. Regular Pap tests are recommended for every woman aged 21 or older, regardless of sexual activity. Is any preparation required before a Pap smear test? No special preparation is required before a Pap smear test. Simply follow the doctor's instructions. However, if you have your period or experience heavy bleeding, it's better to schedule the test for a few days after your period ends. How often should a woman get a Pap smear test? Typically, women between the ages of 21 and 65 should get a Pap smear test every 3 years. The frequency might vary based on your age, health, and medical history. Who should not get a Pap smear test? Women who are 65 years or older and meet the following conditions should not get a Pap smear test. 1. Never smoked. 2. Have had the same sexual partner since their last Pap smear. 3. Have had regular Pap smear tests with normal results. 4. Have not had abnormal Pap smear results in the last 10 years. If I've had a hysterectomy, do I need a Pap smear test? It's recommended to discuss this with your doctor as, in most cases, women who have had a hysterectomy, removal of the uterus, do not need Pap smear tests unless there is a history of cervical cancer or pre-cancerous conditions. If I've received the HPV vaccine, do I still need a Pap smear test? The HPV vaccine reduces the risk of HPV infection and related cervical cancer, but it doesn't provide complete protection. Therefore, even after receiving the vaccine, regular pap smear tests are recommended. Does an abnormal pap smear test confirm cancer? No. Finding abnormal cells during a pap smear test is common, and it doesn't necessarily indicate cancer. If abnormal cells are detected, your doctor might recommend further examination to better understand the situation. What is the cost of a pap smear test? The cost of a pap smear test can vary widely based on factors such as the healthcare provider, clinic, and location. Generally, the cost can range from 200 to 2000 rupees or more. It's advised to inquire about the cost at a nearby hospital or clinic and get the test done as soon as possible. The pap smear test is a valuable tool for detecting cervical cancer and identifying potential risks early. By staying vigilant and getting regular checkups, you can prioritize your health and well-being.